We're the Powder Grove NEDC team, and this is SHU.
All to do is putting on my socks and shoes, and I get it done, but it's not very efficient. So it would be nice to have someone to speed that process up.
That was Mark Hornberg, Director of Services of Independent Living in Columbia, Missouri. He was the mentor for our project. Mark lives with the daily challenges of having muscle dystrophy, a disease which involves muscle weakness and a loss of muscle tissue that deteriorates over time. As you saw, individuals such as Mark have a problem putting on footwear. From this problem, SHU was born.
Muscular dystrophy is a group of disorders that involve muscle weakness and loss of muscle tissue that get worse over time. People with MD often have limited mobility in their extremities along with numerous other complications. In some adults, the disorder worsens and leaves them with moderate complications, while some die in infancy. 1 in every 3,500 to 5,000 males in the United States are diagnosed with muscular dystrophy each year. The symptoms vary with the different types of muscular dystrophy. All of the muscles may be affected, or only specific groups of muscles may be affected, such as those around the pelvis, shoulder, or face. Muscular dystrophy can affect adults, but the more severe forms tend to occur in early childhood. Unfortunately, there are no known cures for the various types of muscular dystrophies. The goal of treatment is to try to control the symptoms.
Our first prototype was constructed out of laminated press board, which provided a slick surface but had little strength. 4 springs were used to elevate and support the movable shoe cup. 2 larger springs were added to the underside, which allowed for the movement of the shoe cup. Some of the drawbacks were the product would only work with larger shoes and boots, was loud, at times caught on the channels, and was not very attractive. We constructed the final device out of oak to enhance the appearance of the product. We removed the 4 smaller springs and moved the 2 underside springs to the top. 2-inch sidewalls were added and datoed to allow for easy sliding of the movable shoe cup.
SHU is unlike anything else on the market. It can be adapted to assist individuals of all ages, which makes SHU extremely versatile. Also, rather than helping one specific person or disorder, SHU can help people with limited mobility as well as elderly people or individuals with a movement-inflicting disorder. The ease of maintenance, including cleaning and storage, makes SHU a great product for retail. Nothing on the market is as viable as SHU. Similar products include the SHU Valet and SHU Horns. However, they require movement from hands and arms, which could be limited to specific people who suffer from different health problems.
All sharp edges and corners were sanded to prevent injury or harmful repercussions. Later, felt was added to the shoe cups to avoid damage to the shoe or user. Non-slip rubber was then added to prevent the shoe from moving while in use. Coil springs were later added with low compression rate, which lowered the risk of materials being pinched or caught within the coils.
Our project consists of 2 stationary cups, 2 mobile cups, felt to relieve tension for the shoe, springs which allow it to move, stoppers for easy cleaning and maintenance, and also for maintenance you can remove the mobile shoe cup for easy accessibility. Also, a non-slip surface surrounds the bottom of all of it to prevent moving when in use. And finally, for easy storage, it is hinged together. And finally, if unable to use dual, you can prop it up, slip your shoe.
Before SHU, putting on shoes was a difficult process for Mark. He wanted a device to help put his shoes on. Our results came when we took the final shoe to Mark for the final test. When Mark first saw our final shoe, a glow appeared on his face. After explaining to him what was put into the construction of SHU, we allowed him to test it. After Mark's first try, he said it was something he would have to get used to, but then later said it was definitely easier than before.
Nice. Definitely a lot easier.